Welcome to the webinar. For those of you who are going through this on the recording, feel free to reach out to us. We'll have some contact info attached to the recording. But again, just want to walk you through where does this fit, what is this all about, and how might you use it, and does it make sense for the career that you're either in right now, or some of you are on this because you're saying, I'm not sure I love the career I'm in right now, and I'd kind of like to enhance that a little bit, or I'm nearing retirement and I'd like something to kind of draw things down with a little bit. So just briefly, our backgrounds, we've been providing health and wellness coaching for literally hundreds of thousands of employees across the country since 2007. So we just started our 17th year. I've been a physical therapist since 1991. Susanna's been an occupational therapist the exact same time. That's where we first met. And then we've gone on to do some other things. Susanna's also a licensed counselor, in addition to being a licensed OT, and is a nationally board certified health and wellness coach. I went back and got a master's in business. I have a PhD in performance psychology, and we've combined all of these things into, we think, based on the response we're getting from students, one of the top coach training programs in the country. And we're one of the first to be approved by the NBHWC. Susanna will get into what that is, but that's the letters you want to look at. If we're not the right choice for you and you have plenty of other choices, just be sure whatever you go with, that you see that NBHWC approved, or National Board for Health and Wellness Company or Coaching approved. And Suze will walk into what the details are with that. One thing just to make tonight easier, I'm going to use the term, or we'll use the terms therapist or clinician as we're talking this through, because this is applicable to both PTs and OTs. We are fortunate to be the only NBHWC approved program that offers CEUs for both PTs and OTs. And Susanna gets all the credit for that, along with some of our team members, because it's a lot of paperwork to get that through. And it was pretty exciting when that happened. We'll walk you through kind of what is this stuff all about, and then at the end we'll have time for Q&A. With that, Susanna, you want to take it away and introduce this whole background of NBHWC process and what coaching is all about?
Yes, absolutely. And I just put my email in the chat box as well. So it's Susanna@catalystcoaching360.com. So feel free to follow up with any questions specific to you or any follow-up questions that you have. But yeah, so it's really fun. Coaching, it's such a great, I think, complement to PTs, PTAs, OTs, CODAs. Just you're already coming in with such great background, great experience. So the coaching is really, it's really kind of an additional tool that you can have that you might choose to use at certain times. So as Brad said, we're going to talk about that. Like, people come through our training for different reasons. The CEUs are amazing, actually, to be able to get CEUs for in the PT arena as well as in the OT arena is super helpful. But beyond that, for whether you are integrating this into what you're already doing with your patients, or if you're wanting to actually sometimes do specific health and wellness coaching, because it is a way of just coming alongside the person, finding out what's most important to them, and utilizing these coaching skills. So it's a whole skill set that you learn. It's basically a different way of communicating with the person. So it's a guiding style. Again, kind of drawing from them, as opposed to kind of our expert hats we're used to wearing as therapists. So this is, in a way, you sort of put on a little bit of a different hat with your coaching hat to come across in a different way. And the information does come across in a different way. So it's a way to kind of engage differently with our clients. Holistic wellness. So if you're like, what do you mean by health and wellness? So holistic. So think all kinds of different areas of life. So it can be everything from, exercise, healthy eating, sleep, work-life balance, dealing with stress, working with people with chronic conditions. I mean, it's a big, long list that just kind of gets you started. So really interesting topics of things. And we are talking to our clients about what's forefront for them on their minds, and how to help them kind of set up goals and get to their vision, to where they're wanting to be. Let's see. Anything else, Brad, with that piece? How you do the coaching, by the way. So it's hands off. So this is not anything where we're, doing any type of hands-on therapy with our clients. So it's hands off. It's a communication back and forth. It can be done on a platform kind of like this, video style. It can be done over the phone. It can be done face to face. Typically, an actual coaching session typically is about a 30-minute time frame. And then the frequency can really vary based on, your setting, what goals you're working on, those types of things. So that's kind of an overview of what health and wellness coaching is. Brad, do you want to maybe share anything more with that, or?
Well, I was just laughing because we have so many PTs and OTs that go through our program because of the CEUs, obviously. But it's one of my favorite things because they come into it, and I was in the same mindset. Like, I've got this. Like, I'm an Ironman triathlete. I read about fuel and fitness and all this stuff, and I'm a physical therapist for 30 plus years. I'll do it to get the CEUs and the credential, but I got this. And almost, I don't want to say every PT, but so many of the PTs come through with kind of that mindset of, well, I want the credentials so I can put on my business card or put in my resume or start marketing myself as a coach. But I'm not really going to learn that much. And then they come out of it and they're like, oh my gosh, that was, I had no idea. I had no idea. I still remember, who was that PT triathlete who came through, and when we were doing kind of our, what was your light bulb moment? She said, I never realized how much you could accomplish by not saying anything. So yeah, there's a lot of overplay. Our daughter's an OT as well. And she shot us a text yesterday saying, don't forget to she's also a certified wellness coach. She said, don't forget to mention, it's not like you're replacing it. You have this incredible baseline skill set, talent, connection with patients, ability to interact with people, and you're adding this extra tool. Sometimes I'll compare it to, I went back to get certified as a manual therapist, and it didn't change the way that I treated patients so much. It didn't change the way I billed, at least. It was still a manual therapy code, but it gave me another tool that I could pull out when I was doing those things. So maybe think of it in some ways as a similar thing as a manual therapy certification or some of the other options, that, hey, it gives you one more tool to help that patient. And I'll talk through the patient care side of things in a moment. One more tool to pull into that patient care element in whatever setting you're in.
And I do want to jump in a little bit. The sound is kind of garbly. So I just want, as you're listening, I mean, Brad and I are in the same location on two different computers. So it's garbly. I'm not sure if I'm any better, but give us a raised hand or something like that if it's to the point that you're having trouble actually hearing. Because as Brad said, he was getting the message of kind of internet issues. It looks like so like you're kind of hearing it. Yeah, so we'll keep going with it, but if any reason we cut out or something like that, we can get the information back to you.
Okay, good. Thanks, Heather. All right. So do you want to go from there, hon, or do you want me to take over?
I will mention just that you had alluded to the National Board for Health and Wellness Coaching. I want to first for us to kind of focus a little bit more on kind of how therapists are utilizing the certification. But I did want to mention the National Board for Health and Wellness Coaching, which did come about in 2016. and really is kind of top of class in terms of credentials. So the training that we offer will get you to that if that's of interest to you. It may or may not be, and I'm happy to give a little more details on what that might look like.
I'll hit the 3 Ps now, just as an easy way to remember where this may apply in a clinical setting. And I'll speak very generically first, and then as we get into the Q&A, you can say, well, what about ortho? What about peds? What about, home health? What about, these different things? So the 3 Ps, make it easy to remember, is patients, passion, and profit. So patients, first priority, that's our big one. You're just gonna see better engagement. I got an email from a PT who that's exactly what he said. He said, Brad, I've been, 6 months out from the certification now, and my patients just more engaged. Like they're doing their home exercise program. They're more like, I keep using the word engaged, but they're there, like they're part of it. They're not waiting for me to fix them. They're involved in the process. And he was just super high on that. And that makes perfect sense from the things that you learn. The other one is follow through. With I mentioned home exercise programs, but they'll simply follow through more because you're pulling in these strategies, this motivational interviewing, intrinsic motivation. You're tapping into their temperament, and so you're pulling that in, and so of course their follow through is better. People joke with us, or at least they want to joke with us about, well, what about your kids? Does this help with being a parent? Because you guys have 3 adult kids now that are all married. Like, did this help? And yes, like amazingly. So it's yeah, Heather, I like your comment there. Not going through the motions just because they're seeing the PT due to the MD referral. So engagement, follow through, loyalty, and less missed appointments. Like, I don't know if that matters to you. If you're just so busy, you're like, oh my gosh, I finally got a break so I can catch up on my notes. But many of you are probably like, if I didn't have 15% cancellation rate, or if I didn't have something we used to call lost patients, that's when you have 8 approved visits, but some reason the patient disappears after 4 or 5 or 6. And so not because they're better, not because you discharge them, simply because they're gone, like they're just not engaged anymore. So these steps, these things that you'll learn becoming a certified health and wellness coach will help you re-engage that piece. And then the engagement of supporters. Many of you, maybe you're in a PEDS type setting like our daughter is, and the engagement with the parents, the engagement with the spouse, the engagement with the other support folks. You can utilize these strategies in getting those folks more involved in the process and having that go down that path. So that's the patient side. The passion side, we hear this, I would say we hear this more than anything. It's the person who says, I love being a PT. Like I 31 years later, I'm not treating patients, but I love being a PT. I think it's one of the coolest professions in the world. And yet sometimes you need a spark. Sometimes you want something a little different. Sometimes you want a fun new tool in your toolbox, not just another tool in your toolbox. So this definitely provides that. So many PTs and OTs you're just naturally into health and wellness to start with. And so you do work out, you do eat well, you do stay up on the latest research. And this allows you to take some of that passion and pull it into what you're doing every day for 8 or 10 or 12 hours a day. Potential side business. We have some people that this is the route they want to go. They're like, I'm not planning on doing anything now. I love my job. I'm staying in that, but I kind of like to do something maybe 5, 6, 7 hours a week that make a little money for the kids' college or for date night, or I want to take this vacation to wherever. And if I just had 5 or 6 clients, that would allow me the ability to put a little more money to the side because it's additional funds that I'm not having over here in this main river, if you will, of revenue. And it offers that, or retirement plans. I can't tell you how many times we've had, especially ortho PTs who are doing a lot of manual therapy say, my hands, I can't do this for another 20 years. I need something to balance that out. And that's why they're coming to us. So again, side business, retirement plan. And then the last one I've got into the passion is it's just a resume boost. It's a differentiator. When I was interviewing PTs and hiring PTs and OTs and PTAs and CODAs, we're super capable people. We're some of the best of the best. I won't get into the detail. You know what I'm talking about. You're scoring the highest on your test scores, and you've got some of the best grades out there, and you're going to some of the best schools. And yet, so are the other people applying for that doggone PT job that you want, or that doggone OT job that you want. So, how do you differentiate yourself further? How do you say, yes, I'm a very skilled PT with a great background and education, and I'm also a certified health and wellness coach? Boom. You talk to any hospital administrator, talk to almost any clinic owner. They're looking at health and wellness as the next frontier, the next opportunity. So that puts you in that role. And maybe it's just as simple as that, where you say, look, I don't want to do this on my own. I don't want to do this on the side. I'd love to step into something where maybe 5 hours a week, 10 hours a week, I'm coordinating that element of our hospital, or I'm coordinating that element of our clinic, or I'm developing this new outreach opportunity that we're doing, or this post-discharge program that we're doing. So those might be some of the things that you look at in terms of boosting that resume, whether it's first job, last job, next job, etc. And then profit. Some of you are involved in the management of your clinic. Some of you are the clinic owners. Some of you are looking at starting your own practice. I mentioned the lost patients. That's a big dollar amount. I mean, you look at those numbers, it's huge. If we can decrease that by increasing engagement, it's immense. I'm convinced you will increase your referral base. We've not done a case study on this, but just think of it logically. Not everyone, some of you are connected with a specific doc and you're getting all of those referrals from her, but not everyone, and probably not even most of you. And so in most cases, the doc has their patient, they decide we're going to do PT, awesome. But now they walk over to their desk and they have, 7 clinics that they can refer to. And so my experience is they kind of play eeny, meeny, miny, mo. Oh yeah, we're going to Mary this time. Oh, you should go see Lindsay. Hey, go see Heather. Go see. They just want to be nice. The docs are like, these seem like nice PTs. I'll try to take turns. Cool. But not anymore. Not if you're a certified health and wellness coach, because now the doc looks at them and thinks of their patient and says, Sally's been having a lot of trouble with her sleep. In addition to this shoulder issue she's got going on, I know Lindsay will at least talk to her a little bit about that or engage that process. I'm going to send her to Lindsay. So again, it's not a magic formula. There's no such thing. But when you think of the tiebreakers, when that doc is in that decision micro moment of who do I send to, it's a good reason to send to you instead. So even if you don't have a wellness program that you're offering, just the fact that you're a certified health and wellness coach absolutely can make a difference. And then the last thing I've got noted down here is it could be a potential lead into cash pay. We were just out at the CSM conference, 10 days ago, something like that. And that was thanks, Heather. I love the woohoo, yeah. That was interesting to hear all the people that was their angle. They're like, I want to do this because, and then the rest of it's obvious. If someone's willing to pay self-pay for health and wellness coaching package, it's not much of a leap to pay for the self-pay, fill in the blank, whatever your specialty is. So that's some of the stuff. We can talk about more of these things. Suzanne's going to walk you through how to get started if this sounds like it sparks something, and then we'll open up for Q&A. So all yours. And we seem to be doing okay with the sound now, so I'll stay on video, but if it dies, I'll disappear, but I'm still here.
Sounds good. Yeah, I'm just going to give a really brief overview. So again, if, follow up with me for the details, but I just want you to get a feel for what the training is like. So it's all virtual, so you don't need to travel at all. We do divide the full program up into 2 parts. So the first is the Certified Wellness Coach, CWC training. You might choose to just start with that and stick with that. Once you finish that, you'll be a Certified Wellness Coach. It is 40 hours used for and it is 4 use OTs, that's the way that
We're
does it.
getting, I think we're getting
So
robot
it's 40
voice.
contact. What'd you say?
Say that again. We got robot voice on that one.
Oh, okay. So in terms of CEUs, it is 40 contact hours. So for the physical therapy and occupational therapy world, with that, as I said, it is all virtual. You do sign up for a weekend training. So it's a Saturday, Sunday that we do. We do them about 4 times a year. So our next one is April 29th and 30th. Really fun weekend. We keep it to 24 people. So you get a chance to interact with other people in the course, as well as Brad and I actually are the main instructors for that weekend itself.
And
Do
I
a
think
lot of
we already
training.
have 4 or 5 PTs in that April course, don't we?
Yeah, we've actually had a lot of I've had a lot of conversations and some OT conversations as well. People interested in it. So typically we have it's not just for clinicians. We have other people who come as well to the training, but we do tend to have a number of clinicians, and which is a great way to kind of interact with other people in the field that have very similar just kind of passions as what you do for the health and wellness. So in addition to that training, you do 12 wellness webinars, all kinds of fun, different topics, all those holistic wellness things that I was talking about. That's all on your own time. You do some practice coaching sessions. Again, that's on your time, where we offer them daytime, evening, weekends, and you sort of schedule, you go at your own pace. So most of this is at your own pace, which is really nice. So a lot of people will finish this in 3 to 4 months. You can totally spread it out longer if you want to, or you can kind of move quickly. So just depending on your time frame. And then once you're complete, you're a certified wellness coach. We do then offer the second portion, which is the Master Certified Wellness Coach portion. And that would be for those of you that are wanting to become National Board Certified. So that's another 30 hours of training, also really fun. We talk about growth mindset and a bunch of like, forming habits and all kinds of different topics. It's really fun. But we will prep you and prepare you to take the National Board exam. And again, we'll work with you with your timing. I'm happy to tell you more about that, but we do have a series for that part of it starting in May, and it's 9 Wednesday evenings in a row. But we offer it springtime, fall. A lot of times people will do a little bit in the spring, a little bit in the fall. So that's kind of the basics. Once you get registered, you can actually get started. So if you're like, this sounds amazing, I want to get started. Once you register, which you can do directly on the Catalyst Coaching Institute website, then we get you information. You can get started with those online portions. We also have a training July 29th and 30th. So if the April dates don't work for you, again, they're every few months. So it's a really fun course. It's a lot of fun to go through, a lot of interesting things to learn, people to meet as you go through it.
Yeah, and I was just going to emphasize what she just said about you can start at any point. So if you do decide, hey, this seems like a good fit, I like to get ahead of things. Well, even though it's March 15th today, you could get most of that on-demand stuff done before you even go through the weekend at the end of April, and then you'd be that much closer to the CEUs. And then just to emphasize the pricing difference. So if you're on the website and you're like, wait, what's this 1992? What's this 3000? What's this 3500 thing? It breaks down. 1992 is the CWC, so the Certified Wellness Coach. If you want to do the master's piece, that's an additional $1,500 approximately. But if you decide in advance that you want to do them both, you save $500. So I don't know the right answer. If you know that coaching is going to be a significant part of your life, your career, your pursuits, then save the $500 and just sign up for it. It doesn't lock you into the May MCWC. You can pick and choose what you need to do with that. If you're not sure, Well, maybe just do the 1992 and see what you think at that point. So we offer both options for that purpose. Most coaching certifications, it's just there's one choice. You do your thing, and we've kept it separate because most people will go for the national board, but it's not right for everyone. So we want to keep that option in there. And then the last thing on the money side is there is a 6 months no interest thing through PayPal. We don't even know you use it, but if that's helpful to you, where hey, I'd kind of like to spread this out over 6 months, just look for the PayPal credit button when you go to register, and it'll be in there. So I think it's time for Q&A.
And I'm going to add one more thing while you all are thinking of your questions here. I did want to mention, so Brad mentioned the cash pay option, which is a great way to do it, and is a lot of, that is how people are doing it now. We are in the process in the industry of moving through the whole CPT code process to be able to bill for coaching. If you would even want to bill for coaching, that's another whole conversation. But we're already at CPT level 3. Just in this past month, they've been applying for CPT level 1 to be able to bill, and it is seeming to be tied to being a national board certified coach. So that would potentially be one reason you might want to go for that. The other tends to be credibility. Particularly in the healthcare industry, we find people really like the idea of national board certification. So again, just to throw that out there as well. And let's see, I see Judy had a question. Yeah, we do the MCWCs in the spring and in the fall. So we will be starting that. I think it is late September. I think it's listed on the website under upcoming events. But Judy, I'd be happy to get that for you.
And they can mix and match,
those
right?
dates.
So
Yeah,
they can make 5 of the ones that start in May, and then they're like, can I come back in September? We allow that, don't we?
Yeah, it's almost even recommended a little bit to not try to cram it all too fast. You can go fast if you want to. And actually the timing of this moment in time, we literally have a training at the end of April and then the MCWC starting in May. So if you're wanting to go quickly, you actually could do that. There can be some advantages to spread it out just to let it soak in as you go through. And I think that's what many people are doing, some in the spring, some in the fall.
Perfect. And you guys feel free to unmute if you'd prefer, or just type it in there. It's fine either way. And you can go into you can get, I think we had 19 people register for this. So you can go micro as much as you want. It's not like there's 100 people waiting. So feel free, jump in with anything specific or generic, either way.
How would you say that you document differently with kind of the mindset of the health and wellness coaching certification within, if you were kind of integrating it into your current practice? How do you document it differently?
Yeah, I think it would be very similar to kind of the manual therapy example of, I didn't change my code. My code was still manual therapy, but I might say XYZ, SI, L23, whatever it might be. And this might be similar. Maybe it's in the home exercise program. You're talking them through, we discussed XYZ to help engage their sleep patterns that'll help recovery, those kinds of things. But by the way, that actually sparks another thing. One of the things we're talking to some surgery centers about is the value of coaching pre and post surgery. If you pull up the literature on, just go down the list of health and wellness things: alcohol intake, sleep, protein intake, overall fueling, seems like there's one more, but regardless, there's a number of things in the literature that you would be impacting as a physical therapist, as an OT, if you're involved in that kind of a setting, that you can pull in much more effectively as a health and wellness coach. And that could be another great marketing tool when you're going out to these physicians to say, here's 3 research studies on X, Y, and Z, and I will be addressing all of these if you send your patients to me. Wow. The data's there. We don't have to do any more case studies. The data is already there. So I'd forgotten to mention that earlier. What else?
Yeah,
Nothing's off limits.
your question, Lindsay, also reminded me. So there is a lot of research out there on coaching, and the foundation of what we use for coaching is motivational interviewing. So there, it's a evidence-based practice. There's so many, like thousands of research, peer-reviewed research out there on motivational interviewing. So that's also, I think, helpful if you're talking to other people, maybe in your clinic, on your team, about what it is you're doing, why you're going through the training, that type of thing. So we definitely share a lot of resources if you're coming through the course about MI, in terms of things to document. You wouldn't necessarily have to document some of the things that you're integrating, but I could see some, depending on your setting, you coming up with some things of kind of the motivational interviewing is all about the underlying why this is important to the client. Like why are they here to see you? Like, what is it they're wanting to be able to do? What about this really matters in their life? So I could see adding that in on a regular basis. This was the conversation. This is what matters to this client. This is what we talked about. So the next time you see them, you ask, what are you noticing with this? Now that you're, doing the PT or the OT or something like that. So I could see adding in some things specific to the why this is important to them that you would be regularly adding into your documentation.
And I just popped into the chat box. We're talking a lot about MI. We actually had the guy that created motivational interviewing, Dr. Bill Miller, back quite a few episodes. It was episode 200, but it's the most popular episode we've ever had in 260 episodes. So if you're into MI or you're just curious, you're like, I've heard about this a little bit, but I don't really know much. He did a really good job. What else, everybody?
I just have a comment, not a question necessarily. I listened to a webinar, I don't know, might get lost in time, a month ago from EIM. And the title of the webinar was, they don't care how much you know until they know how much you care.
Yeah.
Mm-hmm.
So it's great to have that brought back in, because there was such a push for the scientific evidence-based practice, right? Which is very important. But now they're talking more about the evidence of that caring piece, right? It's so huge that I sadly, no offense to anybody, I don't feel like, I don't know that that's much that's learned in school today. It's innate to some people, it's not to others, but there's definitely a difference, I think, in what's out there. But the fact that a big group like that is talking so much about it and actually doing webinars on nutrition and webinars on some of those other things says a lot for where you all are coming from with the coaching piece of it too.
Yeah. Thanks, Erica. Yeah, and the history of health and wellness in PT, I mean, some of you know, I wrote the career coach column for the PT magazine for 20 years. And toward the tail end of that, they had me write something for their online. I don't know if it's still on their website or not, but for a couple of years, they had me do a monthly column on, I can't remember what they titled it. It was some creative wellness related topic.
Is it like well-to-do or something?
Well-to-do, yeah. It was the well-to-do column. And it was basically, how do we integrate wellness into our careers and practices and settings and all that kind of stuff. So it's not a new thing, Erica. I appreciate you bringing that up and reminding us of that. It's age old, it's critical, but we're realizing it. And now we have resources that we can tap into.
Well, and I think the other piece of that too is kind of like, you don't hear it as much in physical therapy, but you hear it in acupuncture and massage and stuff like that they all make a point to work on each other and to trade services. But PTs are getting so burnt out and don't have that somebody to go to necessarily help them. So I think PTs are actually really in need of, everybody in the medical profession is really in need of the wellness piece of things right now, because it's scary, the numbers of people that are dropping out of every profession, medical wise.
Well, and we do a coach the coach program within our company. So I had my health and wellness coaching session last, I think it was Wednesday or Thursday. We really believe in it. We pay our team to, if they want to, it's not forced, if they want to to coach the coach back and forth. And it's awesome. Like every single time. I love it. So yeah, very good.
I had a question real quick too, just because I'm interested in doing a private practice separate from a physical therapist role. So the question I have was, when you're working with someone, how often do you, especially because of the background that I'm coming from as a therapist, how often have you had other coaches who differentiate between their physical therapist practice and their health and wellness coaching practice? How often do they mingle and they have to sort of try to separate it? And then how often do they have to deal with clients who also need counseling?
So many great questions, and Susanna's definitely going to need to chime in on this because she's the dual credentialed, nationally board certified coach and licensed counselor. So she is constantly having this conversation with our own coaches of how do you walk that line, when do you refer, because we love counselors, we love therapy, we think it's critical, and we work like this with them in almost every company that we work with. So that's that piece. We don't want to pretend like we're attorneys and that we know the exact right answer to your first question, but our general recommendation to folks is it needs to be a clear, unambiguous line of distinction that no one in their right mind could possibly confuse the fact that you were functioning as a PT or an OT versus a health and wellness coach. So I, without getting too much background on what you're thinking as far as private practice, it sounded like you're going to work in your clinical role. Yep. And then over here on the side, unrelated to, not an add-on, not a post-discharge program, but literally like you're driving an Uber, you're going to do this over here as a health and wellness coach.
Right.
Again, not giving you legal advice. My understanding is as long as you're very clear on the distinction that I am not functioning as a PT, I am your health and wellness coach in this setting, our understanding is that's appropriate.
Right. I assume that because I'm a PT, I will say this is the background I come from, because it's an additional, people can take me more seriously, right? Sure. As a coach. Oh, you've worked with clients. You know what you're doing, you've had experience. And so that's why I want to bring it out there, but I don't want people to think that I'm practicing as a therapist. But I do wonder, because coaching, there's an overlap with counseling. And so I'm just,
so now we have the expert chime in.
Yeah, it is a great question, Judy, and we actually do spend time during the training talking about that and kind of the language to use with your clients, because it definitely, there's going to be some overlap in terms of the topics you're talking about. The training is completely different for a counselor and for a coach. Right. And many times we as coaches, that's actually a great role we play, is to help connect the person to the specialist that they need to see. So it might actually be going to see a PT or going to see a registered dietitian or getting back to have a checkup with their physician, or seeing a counselor. So many times we're going to ask them, this sounds like this is something that is really affecting you. It seems like it's being helpful to talk about it. I'm not a counselor. I'm wondering your thoughts about going to see a counselor. And so we're going to have that conversation because we're this trusted person now that they'll talk to, which is really nice. And we'll find out, have they ever seen someone before? Oftentimes they actually have, and it's just a matter of, well, what are your thoughts about making an appointment to go see them again, right? And maybe that's part of the goal that you set, is they're going to follow up with a counselor. Maybe they have an employee assistance program through work, and it just reminds them, and they're like, oh, I'm going to look into that. So yes, oftentimes we are talking about that, and it is something we go into more depth in the training, because it is really important to kind of stay within our scope. We talk about that quite a bit, scope of practice, and not to be going in and out like that as well.
Speaking of scope of practice, that's one of the big differentiators, whether you go through our program or somebody else's, that if you're board certified, you have a scope of practice, you have a code of ethics. All of you are most likely enough on social media that you have hundreds, thousands, millions of people claiming to be coaches because they like lifting weights, because they're a fast runner. They're not trained. They don't really know what they're doing. They had a great personal experience and they are very photogenic, so they can, but you know where I'm coming from. So now you have credibility instead of just, and nice photos are fine, everybody, but you know what I'm talking about.
The other thing, Judy, back to your original question about separating the two is again, just, I think, put it on the table when you're having that initial conversation, because you're actually going to do an agreement with your client and, have it in writing as well as say it. I am not operating as a physical therapist. I am not a counselor. You're basically really laying out what it is that you're doing. And as you said, they'll know you're a PT or an OT or whatever your background is. If they're like, oh, my back is hurting, or, oh, whatever that they start doing, then it's like, it's not, let me see, or where. It's, well, that sounds like something that would be good to get an appointment for. Right. And even if you're going to be their PT, for example, that's the appointment that they come into the clinic, right? And they have an appointment on Tuesday at 10. So it's not mixing whatsoever in the conversation.
Right. So it sounds like the training delineates all of this very specifically, like agreements, the business aspect of everything. The training covers all of this, how to set up contracts and all
To a
that
point. Yeah. I don't want to oversell that, Judy. It's a great question. We are unique in that our training includes both lunch hours. I will get on and answer any business related questions that people have. So we do devote time to that. Most programs don't, but there's not a PowerPoint, there's not a sample contract, that kind of stuff. But we will talk through, how should I price my stuff? How do I put my packages together? How would I go out and find clients? That kind of thing. And I don't have the answer, but we have been doing this 17 years. So I can tell you an answer. It may not be the perfect answer, but we do cover that. The other thing we didn't mention is built into your training, if you do the full deal, is a exam prep for the national board exam. That's complimentary. So we don't charge you extra for that. If you decide you want to go for the national board exam, that is built into the price of doing your MCWC.
And just adding on to what Brad said, although we're not giving you specific contracts or things like that we're going to use, there is a structure. Like, we literally have a webinar called Coaching Structure. and it talks about things like that, what to talk about before your session, your first session, kind of going through how to end with a client. So there is kind of some structure to it. Although you'll find one of the fun things I think about health and wellness coaching and even this industry, it's almost like almost anywhere you can think of to do coaching. Like it is at that, it's really at that time and growth and development of like, I think it'd be fun to do coaching with this group of people. That's amazing. It probably would be, right? And it like a way to kind of set something up to do something with people. You can, again, coach people over the phone. You can coach people who are not right there in your home state. You can do all these different things. So there's a lot of flexibility and opportunity to be very creative, to integrate with other clinics or integrative care systems where you've got multiple people working together and you're providing some coaching. Some coaches are doing that. And again, well suited for it when you have kind of a background in healthcare already. So just some other things to think about.
And I just want to answer Erica's question out loud. Susanna typed in the answer, but the April course and all of them will be over Zoom. So you don't need to add any travel to your schedule. We used to do them all in Colorado. So you come in for that weekend. We might get back to offering one of those a year because people love them. We had so much fun together, but at this moment, all of the ones on the calendar are virtual. You don't have to travel at all for that. Marina asked about insurance. Again, don't want to pretend I'm an accountant or an attorney. I can tell you what we've done is, and now our situation is a little bit different. because we're providing these services for employers around the country through our Catalyst Coaching 360. So we do professional and personal liability, professional and general liability, and we spend a decent amount for that because some of our clients are cities that require a copy of it. So we need to have, you know, 3 million, 1 million type thing. My understanding from talking to a lot of the PTs that are doing this is some of your liability programs that you have now, they'll do an add-on for you if you just contact them. And some of them, it sounds like they don't even charge extra. It's not like for an extra $50 a month, they're just like, we just need to know you're doing it and we'll add a rider to it. So I don't know that's true for yours. I don't know that's true for any anymore. Maybe they've changed that, but I've talked to several PTs that have said, I just contacted them, told them I was doing this. They said, no problem, we'll add a rider, and they didn't even charge them extra. So don't quote me on that, but we are hearing that. What else? We're doing good on time. We had planned to wrap up top of the hour, but we've got a good 10, 12 minutes left. What else? Lindsay?
Yeah, how do you see this health and wellness coaching like developing into the physical and occupational therapy programs with like student training?
It's a great question. I'm a WashU guy. Well, Suzanne and I met at WashU, and we've had conversations with him a little bit. We had early on when we first started, probably 2009, 2010, we talked to CEU because we're here in Colorado. It just, you know how it is, the professors feel like they're already overloading the students. They're already trying to pack in, you know, 160 credit hours into 120 hour, you know, 3.5 year programs. So it's just trying to decide, do we eliminate this? Do we add this? My understanding is you're starting to hear more about including motivational interviewing in some of the training. They're obviously talking about health and wellness consistently. We'll get there, but it's just that pick and choose of, okay, if I'm gonna run, maybe I don't have time to bike. So.
Yeah, we've had a number of kind of college PT, OT instructors who have come through, like university instructors and different people come through the training. It is fun at places like CSM when students will come by and they're like, oh, my professor so-and-so talks about this stuff all the time. We're seeing pockets of places.
And we've had a couple have us come out and do a program for their professors and interested students. So they just planned a weekend. They just had us fly in and do the core training there instead of virtually. And then as part of that, they were able to bring in, you know, they had 7 professors and then they were able to bring in another 10 students under that arrangement. So yeah, it's a great way to say it, Susanna. We're seeing pockets of it. But we're not there.
I do see it growing. I mean, similar to what Erica was saying about, I think people are like the pendulum is swinging back a little bit of people recognizing, oh, this relationship between us and our patient really matters to how things go with them. And so, and then just again, with all the holistic well-being, the importance of all of that. So I do think schools are starting, you know, what we're hearing is they will talk about motivational interviewing as an example, but it will be one day of class, right? So they're not really, so they hear about it, but they haven't developed a skill set, right? Because to learn something like that, it is a skill. So you have to practice, which is why you go through a training like this one where you practice with another partner and you have feedback from a mentor coach because you're learning literally a new skill, right? So I think people are starting to realize, oh, this is important. We need to talk about it. We want to integrate it, but we're not to the point yet of like the full training coming in and the full skill set, which would be amazing. And, you know, as Brad said, we did go to the one university where we had a chance to kind of do that on a larger scale. So I'm hoping that it's coming that direction, but a lot of students are interested in holistic wellness when they come through as well, kind of right off the bat. So not so much just later in their careers, but it's seeming to also be a big interest, at least at the conferences that we're talking to them.
Yeah.
Yeah, I know at a healthcare system I worked at about 6 years ago, they started talking about they paid for everyone to go to a MI class. It was all
Oh,
day. Yeah.
okay.
And it was excellent. It was great.
Yeah.
But again, it's the follow through,
Right.
Yeah.
trying to make sure people are implementing it. That's pretty rough.
Yeah.
Well,
do
our son is a second year med student, and I saw a study just came out like 3 weeks ago that talked about when physicians are using MI with their patients, they're losing weight. They lose 5% more weight when that's a priority for them. And I shot it over to him and he said, "That's really cool. And we're getting MI, but I don't know how many of us are using it." And so that's to your point, Judy.
I just wanted to add on just to, like, Brad, you and I met at CSM.
Yeah.
But I just graduated from Finley, and we had a teaching class over the summer of year 2. I don't recall MI being taught in that class, but I can't speak for every university that has a PT program, but it seems like if that's a class that's being offered, this would be a great opportunity to kind of implement this kind of concept into that particular class.
Yeah, no doubt.
But I also wanted to just kind of, I don't think it's a question, it's just more of like a scenario that kind of runs through my mind, because I'm big into, so I've practiced as a PTA for 10 years. I'll be starting officially as a PT here in a week. But yay, first job. Well, third job really, but I've been huge into like the holistic approach to therapy with patients. And as we were talking, like one scenario came up. I had a patient when I was out in Ohio, 45, and I won't go through everything he had. I just remember him having, for 45, having a lot of stuff. It seemed just really, really offset for his age. And the approach I took was, all right, what are you putting in your body first thing when you get up? What are you eating first thing in the morning? I said, if I walked into your house at 9 in the morning, what would you be doing? And trying to create like a scenario for him to be able to look back at himself like, oh yeah, well, I drink Coke, I'm eating all this, I don't work out. But I noticed with him, and it seems like this is a case with a lot of patients, is you have a 45-year-old who, it's like he's broken on the inside, and he really probably does need a mental health care counselor. And then in the same clinic, I have a 90-year-old who's like, I go to the gym every day, I've never smoked, I never drank. And it's like, how do you as a therapist, coach, practitioner of health, reach the person who's only 45 and unbreak him? You know what I mean? Like,
So
kind of glue them back together.
Start, and then Sue's probably has an even better answer because she's really a guru in this stuff. But we talk a lot about something called better than yesterday. So it's never, boy, Judy seems to have it all together. I need to be like Judy. It's kind of that T-shirt you see. It's me against me. Like, what can I do? And helping them think through, not telling them what to do, not saying, Brad, you got to stop drinking Coke, for one of your examples, but more so, how can we get a little traction? What, as you think through stuff, and we won't go into details now, but you get that idea. So you're drawing out, that's the whole thing with the MI, is you're drawing out versus me coming to you and saying, well, from my perspective, you should start doing this and your life would be a lot better. It's more helping them identify one little tiny thing. I was thinking about this when I was running today. I was like, oh my gosh, when I sleep well, everything's better. Like, everything's better. I eat better. I'm nicer to Susanna. I'm nicer to our dog. I exercise more effectively. I'm better with clients. Like everything, I need to get the whole world to start sleeping better. But that's not for everyone. Some people would rather. I heard the other day Netflix's main competitor is not Apple or YouTube. It's sleep. It's sleep. So that's what we're about. So I don't know if that helps or not, but we're as a coach, you'll learn, and that's where PTs really are like, wow, I'm not telling, I'm not teaching, I'm not fixing, I'm drawing out. And then really cool things start to happen. And we talk about the four cornerstones of health: move, fuel, rest, and connect. And the comment we make over and over and over is if we can improve any of those, even slightly, they all slightly improve. So I don't tell you which one to fix. I kind of draw out, well, which one of those, something you want to work. So anyway, I'll stop there just for time. Hun, what do you want to add to that?
Yeah, I think you said it well. Yeah, the general idea is coming alongside them, meeting them where they're at, right? Finding out what, as Brad said, just like what's one thing that's important to them. So like with this client, one thing, like one person in his life who's important to him that he would like to be able to maybe be more active, for example, just to be a part of something, right? So really identifying that. And we actually spend quite a bit of time before we get to the what they're going to do to change, really having them talk that out. So figuring out how does that really tie into their values and kind of go a little deeper. That's kind of the magic of the MI, is just having them voice it, because once they voice it, they're like, yeah, this really is important to me. I really do want to make this change. So once we get them to voice that, why it's so important, then we move to, well, where's one place to start? One thing you could do. And then again, once they're successful with that, then they're able to, okay, now let's move to the next step. So it really is a cool way. And we often will see people that really are struggling in so many areas. And we're able as coaches to kind of help them focus down on just where is something they have control over in their life that they can choose to start making a change. And then the coach is there for accountability, for support, connect them to resources, those type of things. So yeah, that's great.
Yeah, I had one question. I know time is short.
No, you're fine. We can stick around as long as you guys like.
Okay. I know there was a comment, and I just joined the meeting about, and I've read about this too, about CPT codes, right? Reimbursement, possibly. Where's just legislation on that currently? And where do you think it's going to go in the next couple of years?
So it is in process. So the NBHWC, who's the governing body over the National Board for Health and Wellness Coaching, is really working with that. So health and wellness coaching is CPT level 3 right now. They've just applied actually this month for the CPT level 1. And so the projection is 2024. And it does seem to be tied to being a national board certified health and wellness coach. So again, it all has to sort of shake out to see how this is, how this is going to play and what it's going to look like. But it is definitely moving forward with that.
So do you imagine that it'll be associated with a physician? I mean, I'm assuming physician referral, that kind of thing, to be able to get reimbursement. I mean, they haven't, I'm assuming.
Yeah, I think the details are not out there yet. At this moment, there are some ways with a physician being under a physician's referral for different things where some coaching is able to be reimbursed or use an HSA or something like that. For example, if someone is diabetic and the coaching is under the guideline of the physician using a specific code tied to that. So it gets very specific, if that makes sense. But that will all change once it hits the CPT level 1 code.
So what you're saying right now, though, is that there is a very specific circumstances, coaching is being reimbursed for right now.
Under HSAs.
I wouldn't want that quote to get out there without all the other context.
Right, but okay, right. Under
And also, Judy, it's not
circumstances.
all HSAs, but many HSAs are covering it now.
Oh, okay, so it depends on the HSA and specifically.
Yeah.
That's number one. Okay, but that's good to know, right?
Yeah.
That's
The main thing is they're doing all the right things. They're going through all the right channels, getting it, everything, all their ducks in a row to really move forward, to make this as just another option. So for people who are wanting to run this through insurance, it will be there in the future. Others may choose to just stay cash pay. Certain whole different things there. But it is exciting actually to see the industry moving in that direction.
Right. I guess my thing is the population I usually work with, they're socioeconomically disadvantaged. So I'm like, you look at, you see some of the programs where you're like, okay, $2,000, you can see for 3 months, they can't afford it. And they're the ones who need the most, right?
Yeah.
So
that you may be able to tap into some grants for, you may be able to tap into kind of our approach of doing the employee wellness. You're working with a company or a small business that, frankly, small businesses are very underserved. We now go down a little bit lower with our new model, but we previously would only go to about 150 to 200 employees. So all the employers with 50, 70, 90, if we're not serving them, nobody served them, because we were going far lower than most employee wellness companies would do. So I think that's a great opportunity for you too. And then you're serving those employees through that other realm, if you will. So it's not easy, but it's there.
right, it's an opportunity.
Yeah.
Right.
Yeah.
Okay.
The other thing to remember that I try to remind myself, because I get discouraged, even 17 years in, I'm still trying to figure out how do we get more clients for our corporate business. And I have to remind myself, I'm not looking to be the Amazon of coaching. We're not looking to be the GE of, if we have 5 reasonable sized companies that come on board, we're doing great. We're happy. That's fine. We're making a difference. So for you might be like, if I could get one small business and one grant and then have a couple of individual clients over here, I'm good. Like I can't do anymore. So yeah, I think perspective is important too, because it is easy to go, man, that's a lot. I'm competing against Virgin Pulse and I'm competing against, whatever. No, not really.
And it's the whole premise again of everyone can use counseling and all that. Everyone can use a counselor at times. Everyone can use a coach. And you've actually said that earlier too.
Absolutely.
Everyone at certain times needs somebody to help them become more accountable.
Well, and it's not even accountability. It's thinking it through. I will use myself as an example because I'm a weird person. Like I've done 11 Ironmans. We won the Race Across America in 2016. I love eating healthy. I love reading all this stuff. And yet, every time I have a coaching session, I come out of it like, why did I? She's not telling me stuff. She's not informing me of things that I didn't know. She's drawing out, what is the reason you're doing that, Brad? Why are you taking that route? Is that really the best route for it? Like, it's amazing because this is literally my job. And I still come out of these coaching sessions saying, that really made a difference.
Yeah, and I will say, if you want to get a feel for kind of what would a coaching session kind of be like, it was the March 13th, right, Brad?
It was this last Monday's episode.
Yeah, of Catalyst Coaching 360 podcast.
No, just Catalyst 360.
Oh, Catalyst 360, sorry. Catalyst 360 podcast. It's a coaching session. And then what I'd like after is there's a debrief. So the coach is actually telling you what was going on in her brain as she was coaching. So it's really interesting, I think, just to see in a short amount of time what that conversation was like. And Heather, back to your kind of question about with your client and like, what do you do? This person is totally, in a totally different time of life than what you're talking about. But I think it's a great example of kind of drawing from the client like letting, like coaching, like sitting back and pausing and allowing them to kind of process through, what would this look like in my life? What is important to me? So that might be another good resource. And Brad put on there in the chat box the Catalyst 360 podcast, but there's tons of great. We have a number of other ones that are not practice, but actual coaching sessions, but also just a lot of interesting health and wellness topics and performance topics.
Where would you say like the job industry in terms of if we just didn't want to start our own business, but just wanted to kind of jump in as a coach, kind of as a part-time off to the side gig, where do you see the job market right now and kind of where do you see it going?
Well, it depends on which part of your question. So at first I thought you meant like jump out of full-time PT or OT and jump into full-time coaching. I think that's still a struggle because companies are catching up with the amount of coaching being utilized, and then we've got a lot of coaches that are going through the training on a national level with all the different programs out there. But on a part-time basis, and Suze, please tell me your thoughts on this because you're dealing with this on a day-to-day basis more. But I think part-time is good. If it's something where you're just looking for 5, 10, something like that hours, I think it gives you a lot of flexibility that maybe a lot of other coaches wouldn't be able to offer.
Yeah, I think,
and that's if you're not starting your own thing.
In the industry, you'll find independent contractor positions where it can range a lot in terms of how many hours you're working with someone, with a company, as opposed to, a full-time employee position. As Brad was saying, sometimes that's a little harder to get, although they are out there. More and more companies actually are adding coaching services in a lot of different industries. Even you see things like, some of the different apps, technology apps that are adding coaching on to what they're doing. So it definitely is growing. I would say in the job industry, if it's not someone you're already connected to, like, a physician that or, a rec center where you already have a relationship, being national board certified, I think if you're out in the job market, I would recommend that, because a lot of job postings are now starting to ask for that, or at least that you're on your way to being national board certified. So I would say if you're actually wanting to get employment, that would be a really helpful piece. And once you are part of that group of national board certified coaches, there's a super active Facebook group. There's a job board on the website actually for the NBHWC where people are posting jobs. If anybody speaks Spanish, you'll be golden. That's very needed in the industry actually, is if you can speak any other language in addition to English, is an amazing thing, because right now the industry is really needing that as well, I would say.
And so for being employed by a corporation, for instance, a company, do you have any idea how comparable it is to therapy salaries and wages?
I don't know. I think,
Okay.
and even therapy is so variable. Like if you look at what people are charging, if they're doing therapy through an EAP, their reimbursement is much lower than if they're in private practice. So I think even if we didn't try to compare A to B, if we just said, what's the pattern with B, I don't think there's a great pattern. So much of it is dependent on what like you even said, I bring a little more to the table. Yes, you do. And now who can you network with? Are you willing to go fill out the grant paperwork? Are you willing to go talk to employers? So a lot of it is, I hate to say sweat equity, but it's kind of sweat equity if you want to go that route. And that's different than what Lindsay was saying. She's saying, hey, I'm going to keep my job. I just like to hook up with, some company for, you didn't say 5 to 10 hours, but I'm assuming 5 to 10 hours. So kind of different perspectives there. But if you're willing to put in the sweat equity, I think the potential is pretty good.
Okay.
And then you write your number and then you see if the market agrees with you. Like we never get to decide our price. We get to put a price out there and then the market tells us if we are right or wrong.
Exactly, right? It's about what people perceive if you have offer enough value for the price that you do put out there.
Yep, exactly.
Right.
And that's where we talk about packages, and I'll walk y'all through that if you end up going this route. So,
Okay.
gang, you guys are awesome. I never had in my mind we would go extra an hour and 15 minutes. Mary, did you have any
Oh,
questions?
I did. I did
Yes.
have, it's kind of almost a 3-part. So sorry for taking a little longer.
We're here.
But I actually went through the CWC training through the Catalyst 2 years ago. And then I started the whole process trying to get a little experience process on opening up business, getting everything registered, and then life kind of happened. So that kind of went on the back burner. I got married. So that was a little more important at the time. So I guess, is there any time frame as far as if we go from the CWC and how, if there's multiple years before you go through the like the board certification
I like how
program?
she spread out the multiple years, Suze. I like how she goes multiple years.
Because even if it's like another year or two down the road, if
Right.
that would be kind of a hindrance on progress in going that route.
Yeah, I would say just give me a call.
Okay.
Or email
take care of
me
you.
and let's look at your account, like what you've done. Let's look at the timing and see. So as long as, you know, it's been within this same amount of years of the same cycle of requirements to the NBHWC, then you can just kind of jump right in.
Okay.
If not, we'll help you with what you need to do with that. So yeah, it's a good question. We actually have a lot of people that will start and do a part of it, and then they're like, oh, I want to go further, or for whatever reason didn't finish and loop back. So yeah, we're here to help you. Yeah, get back into it. I'm glad you're kind of getting re-engaged with it. Congrats on getting married, and would love to catch up with you. So I knew I recognized your face actually.
And then is there a spot where you indicate, because I know when I had first gone through, it was still unsure from state to state on CEU pre-approvals. So when I look at like the list of, I know I need to take like another webinar and that to kind of keep things fresh, and that, like, will it indicate if it's pre-approved by certain states or?
Yeah, check with me on that as well.
Okay.
Because yeah, we're through a new group now, Redefine Health Education, and
Okay.
they're in over 40 states where it's already pre-approved with us, which is awesome. And even for the other ones, they give some good information about what you can do for that state.
Okay.
So yeah, just reach out and I'm happy to help with that, to give you those details.
Okay. And then last, for us rusty coaches that have kind of been out of the loop, do you offer it all? And I know, like, we've had the practice sessions that we would sign up before we would get like our final. Do you offer that for anyone that's already maybe gone through the program that wants to either be a listener or a client coach during a practice session?
So we do. So just so everybody knows, part of what we do with the practice sessions is we do have a calendar where you sign up and you practice with another person. You get feedback from the mentor coach. So yeah, it can be worked out to be a listener for those, which is nice. Okay. So again, Mary, I'll work with you on looking at your account. But the other thing we really recommend is once you get into that second level, the Master Certified Wellness Coach program, everyone in that is moving towards the national board exam. So we've been having great interaction with those group lately of like forming their own Facebook group and connecting with each other, and people that want to, who are like, let's meet, every other week just to practice with each other. So we really recommend, so it's not something you pay extra and like an extra official program. We really highly recommend kind of that interaction so that you're just coaching with each other and getting that practice.
Okay. Awesome. Thank you.
Yeah.
And then Sarah asked about, are there yearly educational requirements to maintain certification? Suze, I can't remember the details. The first year there's nothing, and then it's one a year at the student discount. Is that right?
Yeah. So just to keep your account in good standing through Catalyst Coaching Institute, your certified wellness coach. it's like the third year after you graduate, we ask you to do one webinar per year to keep your national board certification. So that would be through the NBHWC. It's very similar to other certifications. It's like 36 hours of training on a 3-year cycle. We are approved as continuing ed providers for that. And you do get a discount as being a graduate of our program. So a lot of students will, come back to us to take continuing ed for that national certification. We also do a yearly retreat up in Estes Park, Colorado for coaches.
It's amazing.
Yeah, it's so fun. And it's
fun.
for people, no matter what training program you go through, but it's approved for 14 credits. So we have some coaches that just come on a yearly basis, and that takes care of your credit
36, yeah,
as well. So yeah, we're involved with all of that and happy to help you with that as well.
And about the practicing with your peers while you're working on your, and all those letters, MCWC, sorry. Does that help toward your requirements for your practice coaching, or is that totally separate? It's just a practice. And then you still get your separate pseudo clients somewhere else.
Yeah, that is totally separate, just practice to, just build your skill set. There are some coaching sessions that you need to do before applying to take the national board exam. And we talk about all that during the training to help you figure out how to find those clients and what to do.
Okay.
Yeah,
And
the national board actually won't allow us to provide the practice coaching sessions toward your 50 required. So we will walk you through, we'll get you a lot of practice so you're ready. And then we'll walk you through, it's not very hard to do it. We'll walk you through how to get those set up.
okay. And then last thing, I know you had the continuing ed, and I think I asked you already, Susanna, I just want to clarify. Those continuing ed for the, the letters and all that, they do not go towards your your therapy CEUs. They're not the same. It's just the CWC.
Yeah, they're not pre-approved for that, depending on where you are. It might count depending on how your state is set up. But yeah, the ones we have gone through for pre-approval is that initial CWC 40 contact hours.
Right.
Which I think for most states, the 40 will probably cover at least a 2-year time span for our therapy license. So that, if that's helpful.
Yeah.
Okay.
All right. Any others? You guys are doing great here. All right. Looks like going once, going twice. Reach out to us anytime. We really appreciate you doing this with us. This is the first time we've done it. It seems like it was helpful. So we'll maybe do another one sometime, but let us know if you have any questions. And if you want to get in that April one, next couple of weeks, you probably don't have to rush it, but I wouldn't wait too long before that one fills up. So have a wonderful night, and we will be here if you need anything.
Thanks.
Brad,
Yes.
if we're interested in like the July one,
Yeah.
when should we?
So that's totally up to you. You could register now if you wanted. There's the 6-month no interest if you wanted to say, hey, I need to spread this out a little bit. And then you could start the on-demand pieces, or there's no rush. If you said, yeah, I'm not going to touch it, you could wait till May, June, you'd be fine.
Okay.
Don't wait till July. But I think if you wanted to wait and you didn't want to get a running start with the on-demand, you could wait till May or June.
You're always welcome, Heather, to check in with me and just see where registrations are. And I can let you know if we're getting close to capping, because sometimes we do fill because we keep them small. But you could check in with me if you're kind of pausing for just a bit.